There are many levels of involvement when looking at Arlington senior care options. The level required depends on the person who will be the recipient of the attention being given. The choices range from non-medical, in-home assistance to 24-hour daily attendance by certified medical personnel. To determine what level is best for your needs, most facilities and services will administer a questionnaire designed to help with that decision. The first level of assistance that is commonly available is non-medical assistance, performed in the home of a potential client. The assistance usually associated with this would include housekeeping, errands, shopping and some cooking, and perhaps feeding assistance. This is the most affordable of all levels and usually the most accessible for consumers. An adult day support center tends to take charge of older and younger adults that may be suffering from neurological issues. Many times they cannot be left alone at home while other family members are working. There is usually a social director that schedules activities for participants and the staff provides transport to and from the facility. An attendant who lives in the home with the client is in charge of medical issues and trained to administer shots, medication, and other health issues their client may have. They do not always live at the residence, but instead work 8-hour shifts that cover times when the client is awake or alone. This person will generally need a nursing degree that entitles them to do the medical procedures. Assisted living facilities are an alternative to the live-in aid. There are 24-hour attendants, as well as physical therapists and nurses. As a rule, these facilities are affiliated with at least one doctor and a hospital that is nearby. Here all of the ABLs or activities of daily living are taken care of, and a schedule of social activities is available for all residents and guests. Most assisted living facilities are connected to a memory wing, where persons who suffer from dementia or Alzheimer's disease can live out their days in relative peace. These are usually locked units to help keep the residents from wandering away. In these wings, all needs are tended to by staff and medical specialists. Hospice is the final level of support available to the older generation. Hospice is given to persons who have been diagnosed with less than 6 months left in their lives. Some hospice workers come to the home of the person who is suffering, and others work in a facility that houses the cancer victims until they pass. Many times the worker that goes by the home is there as much for the family as for the victim. They both get a short period of respite. Arlington Senior Care offers a full spectrum of services and all levels of support for the client and their families. Many of these services are partially or fully paid for by Medicare and Medicaid. For persons who wish to remain living independently, there are housing programs sponsored by HUD that offer reduced rental costs. The seniors in this city need not worry about assistance options available to them.